evening. So I'll now hand over to Zibby, who is our Cuimhne coordinator, who will speak briefly and then she'll hand over to our speaker for this afternoon. So over to you, Zibby.
Thank you, Aisling. So a warm welcome to everybody. We're delighted at Irish in Britain to welcome you to today's Thoughtful Thursday session. And we have our guest today, Dr Eithne Heffernan. Eithne is a researcher based at Nottingham University, and she's also someone who has an interest in memory and an interest in dementia. She's been a personal family carer herself, and she's also currently at the moment looking into research around hearing and hearing conditions, and interested to explore the kinds of questions that might be asked around this in connection with memory. So we're delighted to welcome Eithne. Eithne is a member also of Dementia Carers Campaign Network in Ireland, and we're going to hear first of all about hearing and memory, with plenty of opportunity to ask questions at the end. So thank you, Eithne.
Thanks very much. I'm really grateful that you invited me to come speak today. So as has been said, I'll be talking about hearing and memory. So I'll start off by giving a background about different hearing conditions and then talk about how they are linked to memory conditions. Okay. Oh, sorry. So at any point you need me to clarify what I'm saying or to speak up or speak more clearly, just let us know. You can type a message in the chat. Or if you want me to repeat something, just let me know. So just a bit of background. So I'm originally from County Mayo in Ireland, and I'm now working in the University of Nottingham as a researcher. And my main research areas are hearing loss and its impact on social engagement, and also its relationship to memory conditions. And so I'm not a clinician like an audiologist, but I do research in this field. So I'll be talking about some of those topics today. So these are some of the main areas I'll be talking about, and you're welcome to ask me questions about these at the end of the session. So I'll be talking about different hearing conditions, getting a hearing assessment or getting support for your hearing conditions, some of the issues around stigma and hearing loss, how to help people with hearing loss access and be included in different events and meetings, and also the relationship between hearing and memory. So to start off, I'll just give you some background information about the different hearing conditions people can have. So hearing loss is a very common condition. It affects about 12 million adults in the UK, and that means about 1 in 5 adults. And it's especially common in older people. So that would be in people aged over 70 years, approximately 70% have hearing loss. But it's not just adults, it can also affect children and teenagers as well, and young adults too. And hearing loss can have quite a significant impact on your quality of life. These are just some of the main areas that hearing loss can affect. Of course, it affects our communication and our concentration. It can also have a significant impact on your functioning in work or in education. Many people say it affects their social life and their relationships with other people, and particularly their family members and their spouses. And all of that can then have an effect on your emotional and mental well-being as well. This is a quote from a lady I interviewed in a study I did in Nottingham who has hearing loss. And she said, "I'm with the family and they are talking, and I feel as though I'm not in the same world. I'm too old to babysit my grandchildren because I couldn't hear what they were saying. It's depressing, really." So that's just an example of one person's experience with hearing loss. And it can have quite a significant impact. And many of the areas that hearing loss affects are similar to the effects that memory conditions have on people as well. There's a lot of overlap between the two, and we'll look at that later on. So there are different types of hearing loss. It can be bilateral or unilateral, and that just simply means you could have hearing loss in one ear or in both ears. It can be gradual or sudden. Some people, it slowly progresses over time. Other people, they can have a sudden hearing loss, and it will be very important to get that investigated, as soon as possible. Hearing loss can also be congenital or acquired. So essentially, you can either be born with hearing loss, or you could acquire it after birth, and that could happen in childhood or in adulthood. And finally, hearing loss can either be conductive or it can be sensory neural. So conductive hearing loss is simply when there is a blockage or an abnormality in maybe the outer or middle ear. And that could be for things like because of excessive wax or a perforated eardrum. And oftentimes conductive hearing loss can be corrected. It's often temporary. Sensory neural hearing loss is a bit different. It tends to be caused by damage to the inner ear or to the auditory nerve that connects your ear to your brain. And that can be due to the wear and tear that takes place over time as we get older, due to excessive noise exposure, and there are lots of other causes as well. And that often is a long-term permanent type of hearing loss. Or you could have a mixture of both conductive and sensory neural as well. If you go to see an audiologist, your hearing loss will usually be classified as either mild, moderate, severe, or profound through the hearing tests that they'll give you. But it's important to be aware that even a mild hearing loss can cause significant difficulties. And if you have a mild hearing loss or moderate, you are still eligible for an intervention. So you might still be eligible to get hearing aids. It's called mild, but actually the example of that woman I spoke about earlier who couldn't hear her family and her grandchildren anymore, she would have been in the mild to moderate range, but it actually had quite a big impact on her life. So that's just important to remember. You often hear this term hard of hearing. And what that means is it normally refers to people who have mild to moderate hearing loss. And they tend to use spoken language like I'm doing now. And they might use hearing aids or they might use cochlear implants if they have a more severe level of hearing loss. And they're different from the deaf community. That's another term we often hear. And that means people who belong to a particular cultural, social, and linguistic group. They tend to use sign language, and they have their own culture and society, their own customs and clubs and organizations, and their own identity as well. And because of that, because they have this kind of rich society and culture, it's thought that sometimes they might actually experience less social isolation than someone who maybe starts to lose their hearing later in life and has to make that adjustment and maybe doesn't have a social network of other people who have the same experiences as them. So it's just helpful to know about these different groups. Now, so there are other hearing conditions other than hearing loss. Hearing loss is probably the most common hearing condition, but many people also have tinnitus as well. And tinnitus is usually thought of as being able to hear a ringing or a buzzing sound in your ears, though it can be other sounds as well. It might be a hissing sound. And it's not a sound that's actually there in the environment. It's just a sound that the person themselves can hear. And for some people, it's very bothersome. We all experience tinnitus at some point in our life. Maybe after we've been to a concert or a nightclub, you might have a bit of a feeling or a buzzing in your ear. But for some people, they have very loud tinnitus, very chronic tinnitus that they experience every day, and it causes a lot of difficulties for them. There's also a condition called hyperacusis, and that's a sensitivity to noise. And again, we all experience times when we're a bit sensitive to noise, but this is where people find noise maybe very painful or stressful or distressing or very bothersome to the point where it really affects their daily life. Many people with memory conditions have noise sensitivity. It can also be common in people who have things like maybe autism or different conditions, but it can also occur by itself as well. And we don't know that much about it really. There's also a condition called auditory processing disorder. And that's where if an audiologist gave you a hearing test, on their tests, your hearing would appear to be normal. You wouldn't appear to have a hearing loss, but you still experience difficulties, usually with understanding speech, or especially understanding or being able to hear sounds in a noisy environment. You still have difficulties, even though on the normal hearing tests, you appear to be fine. And again, that's something that we need a lot more research on. Sometimes you'll hear it talked about things like hidden hearing loss. Okay, so getting your hearing assessed. Well, we know this is a big issue. Many people have lived with hearing loss for about 10 years before they are actually referred to appropriate care. So many people, either they themselves don't seek treatment or seek help for their hearing, or else sometimes their GP or their carer doesn't refer them for help. And we're going to look at why that happens. So when should you think about getting your hearing checked? This is a big long list of common things that mean you could be having an issue with your hearing. Certainly if you have a sudden change, you should get it looked at. But also people might be telling you, the television's too loud. You might find yourself getting tired from really concentrating on listening. You are struggling on the phone, you're struggling in a group conversation. You feel like everyone is mumbling. And that's a very common report because hearing loss, especially age-related hearing loss, you lose the clarity of speech. It's not always about the volume, it's about the clarity. And so you've kind of lost some of that. And you're often asking people to repeat. At that point, it would be worth considering looking into it. So you can speak to your GP and they may refer you to an NHS audiology service. Some people choose to go private. There are some pharmacies and opticians that offer a free test, but you can also get tested for free on the NHS. So, it's worth speaking to your GP. You can also, if you just wanted a quick check from the comfort of your own home, you can do a basic test on the RNID website. That's the main hearing charity in the UK, and they have great resources and information, but it isn't a full assessment. It's just an initial basic check. Okay, but as we said, many people don't get their hearing looked at. And why is that? Well, one thing, it's gradual in many cases. So people genuinely don't realize that their hearing has changed and is getting worse because you don't know what you're not hearing. And it might be that other people are telling them because they don't realize themselves. Also, sometimes hearing loss is just seen as normal, just one of those things that happens. And people don't realize you actually could do something about it. There is help available. And it's not just people with hearing loss who might think it's normal. Also, a lot of GPs or clinicians kind of normalize hearing loss as well, and they don't refer people on. Sometimes it's not seen as very important. You know, you might have other health conditions that are taking priority, or you might not kind of think it's having much of a negative impact. But for some people, it really does have an impact on them, as we talked about earlier at the start. And sometimes you don't realize how much it's affecting you. And it can also affect maybe your family members as well. So it is worth looking into it. The other reason people sometimes maybe avoid having a hearing test is because there's a bit of a stigma associated with hearing loss and with hearing aids. And we'll just look at that now. So this is a quote from a gentleman with hearing loss that I interviewed. And he said, "It signals you're older, and it's a bit socially embarrassing to admit that you have a weakness." So he kind of didn't want to give in that he had hearing loss. And in the end he did, and he got hearing aids, and he's, you know, happy with that. But it took him a while to kind of accept that that was the case. This is another lady I spoke to who had hearing loss, and she said, "I want people to see me as me, not me with a hearing aid or me with a walking stick. I want them to see me as I was." And then this is an audiologist I spoke to, and she was talking about people with hearing loss. They feel, "I don't want to look stupid or to keep asking people to repeat." They stop going out and they think, "I'm going to make a fool of myself." So there is this kind of stigma around hearing loss that it's associated with being older, and maybe it's, you know, a sign of weakness or that there's something wrong. Or, you know, you can feel like you look a bit foolish by having hearing loss. But actually, a lot of that stuff, there are negative labels that just aren't really true. You know, hearing loss can affect people of any age. It's very common, 1 in 5 people at least have some sort of hearing loss. And, you know, it really can happen to any person. And really, people who have normal hearing need to be more accommodating, you know, and understanding and just more aware of what hearing loss is, and that someone might not have heard what you said and you need to repeat for them, you know, that that's a normal thing. Okay, so we'll just look at support for hearing conditions. So for hearing loss, these are the main interventions. The most common one would be hearing aids, but there are also other devices you can get. You can also go to lip reading classes. Some people are eligible for cochlear implants, and you can also get different advice about tactics and strategies you can use, which can be very effective. If you're not ready for hearing aids, there are kind of simple changes you can make to help you hear better. For tinnitus and hyperacusis, there are some interventions available. One would be sound therapy. So that can include maybe a sound generator to kind of mask the sound of tinnitus. Sometimes people are recommended a combination device, which is like a hearing aid that also has a masking element to it. They're also recommended to try psychological therapies like mindfulness, or to go to support groups. But unfortunately, we don't have any cure for things like tinnitus and hyperacusis, and there's also a lot we don't know about them yet. So research is ongoing looking at things like drugs and other interventions, but it's a long road at the moment. In terms of hearing aids, there are many different types of hearing aids, behind the ear or in the ear. There's also smartphone connected hearing aids. The NHS does offer free hearing aids, and they are quite good. Some people think they're going to be a really old-fashioned device. That's not true. If you go private, there is maybe more of a selection, but obviously they cost more, so that's the difference. But you know, it's worth investigating your options, and many people I've spoken to are quite happy with what they've had from the NHS. Some have opted to go private. It's, you know, there's plenty of good information out there about the different options and what you might suit your particular type of hearing loss and your particular circumstances. There are also a lot that we can do to assist people with hearing loss, to take part in conversations in social situations and in workplaces, and we could all make basic changes to help them. So obviously make the effort to include everyone in the conversation. Reduce background noise. That background noise is a huge problem. So turning off the radio, or if you're in a restaurant, you could ask for the music to be turned down, things like that. Stand in good lighting so they can, you know, read your facial expressions and your lip movements better. Face the person. Try to speak clearly rather than shouting. Repeat as often as they need. A lot of people kind of give up after repeating something twice, but really we need to be more patient than that. And speak one at a time. All of this sounds very basic, but a lot of us don't do it. A lot of us talk to someone with our back or our head turned away, or we talk to them, shout at them from another room, things like all these little bad habits. If we just made little changes, it would help people a lot. Here are some tips for meetings and events. So there's a loop system that helps people with hearing aids hear in shops, train stations, theatres, lots of different environments. And you should ensure that that system is working if you're booking an event somewhere. Some people, you know, members of the deaf community might appreciate an interpreter. Some people might appreciate closed captions, which are similar to subtitles if it's an online meeting. There are also apps that do speech to text. Not everyone will want to use them, it depends on the person. Choose a suitable environment, as I said, somewhere quiet. Also soft furnishings. Most places are like hardwood floors now, but soft furnishings are better for hearing loss. So have a think about the environment. And somewhere where everyone can see each other's face, you know, you're all sitting in a circle or semicircle. Provide breaks, because listening can be very tiring. Allow people to bring someone with them if they want to. Ask about their needs in advance, and also give them written information rather than just making them rely on their hearing. So this is kind of the last topic I wanted to go over. So I'm going to talk about the links between hearing conditions and memory conditions. So many people have both a hearing condition and a memory condition. So a lot of people who have certain memory conditions like mild cognitive impairment, cognitive decline, dementia, things like that, also have a hearing condition. And people with hearing loss could be more likely to develop a memory condition. A lot of evidence is emerging about that now. And also, memory and concentration could decline faster in people who have a hearing loss. And that's often why another reason why it's good to protect your hearing when you can, to prevent loss or to prevent additional loss. And also to consider getting your hearing checked early on, rather than leaving it for a long time, because there's benefits to tackling it early. And the thing about hearing and memory conditions is they have many similar symptoms and effects, like communication problems, social withdrawal, concentration problems. And that makes it more difficult to diagnose and treat them. Sometimes if someone is being assessed for a memory condition, they might have a hearing loss that the doctor doesn't know about. So if they respond to a question incorrectly, the doctor might think it's because of their memory, but actually it was because they didn't hear the question. So it just makes things a bit more complicated. It's always good to tell people if you have a hearing condition, and also the doctors should check and should use tests that have been adapted for people with hearing loss. Okay, so what links hearing and memory? Well, we don't know for sure. There have been some ideas put forward by researchers. So one thing is that hearing loss could place extra strain on your brain. It takes a lot of concentration and effort to listen and absorb information if you've got hearing loss, at least for some people. So maybe that is a bit of a burden on your brain. Also, hearing loss, perhaps it leads to changes in brain structure and function that could then lead to memory conditions. Hearing loss reduces the amount of stimulation that your brain gets, potentially, and it also means you might be more cut off socially. So then you're not getting social interaction and stimulation. Maybe that leads to memory problems. Or maybe it's just that hearing loss and memory conditions both have the same cause, like maybe there's a gene that causes both hearing loss and memory problems, but we don't know. And then also you meet people who have a memory condition who have good hearing, and people who have a hearing loss and who have great memory. So, you know, it's a complicated thing. And I'll just end by talking about very briefly the research I'm doing. So I'm looking at hearing and memory with online and in-person focus groups. And I want to find out what research is needed in the future about hearing and memory. And how can we make this research more inclusive of minority groups? And to do that, I'll be speaking to people with memory conditions, people with hearing conditions, their relatives, their carers, clinicians, researchers, and campaigners. And we've already started and done some focus groups. We're especially looking to speak to people living with memory conditions and their relatives or their carers. So if you would like to take part, or if you know anyone who would like to take part, please get in touch. The focus group lasts no more than 1 hour. You can bring someone with you if you want. You'll get a £10 shopping voucher. We have places available at a focus group online on the 30th of June, but there will be other dates available as well. So if you're interested, please get in touch. That's everything from me. Thanks for listening. And if there's any questions, please put them in the chat.
Thank you so much, Eithne, for that brilliant presentation and overview. We have a few questions here. Should I start, Zibby, with a question?
Yes, please do, Ashley, please do.
Sure, thank you. I mean, that was very, very, very thorough, and you covered a lot of ground there. Just a question here, Eithne, just about people who have hearing aids that might find them uncomfortable. What would your advice be, and where could people go for support with that?
Yes, that's very common. Because hearing aids aren't as simple as, you know, reading glasses. They take a lot of adjustment, and many people have to have a few appointments to get them comfortable and to get them maybe tuned in the way that they want them. So, and if you have your hearing aids from the NHS, you might not get an automatic follow-up appointment. They kind of leave it up to you to book yourself back in, but you should do that, you know. Obviously it's not always easy. People have lots of appointments and very little time, but you are entitled to go back and have follow-up. That's totally normal, and it's not a burden, you know, like it's expected that you might have to go back in a couple of times. And they should be, you know, you should tell them if it's uncomfortable. Sometimes they're too loose, or they're, you know, some people do experience itching or things that does happen, but it's worth telling your audiologist. If you don't have time to do that, or you need something quicker, I would suggest going on the RNID website. That's the main hearing loss charity. They have online forums, they have a support telephone line, they have audiologists. I think you can speak to people online as well that will they'll give you advice. And they also have lots of resources and information you can read. Also, there are sometimes, you know, hearing support groups of different hearing aid users who maybe, if you don't fancy going to the clinic, if you could find a group, sometimes they go on social outings and, you know, they all use hearing aids or they all have hearing problems. And that can be a good way to get advice as well, and also go to somewhere where everyone knows how to communicate in a way that is helpful for you. So those would be the main things I would advise.
Brilliant, that's really helpful. Thank you, Eithne.
Thank you, Eithne. Could you tell us a bit more about how the online focus groups work? And I wonder, maybe we could stop screen sharing, then we can see.
Oh yeah, sure.
Brilliant.
You know what, we were talking about how earlier I'm a bit tech savvy, but I always forget how to stop sharing, but I've done it now. So it's interesting when you're meeting in an online way with people that may perhaps be helped by lip reading or different things. How does that work in an online setting? It'd be great to have some tips for us and for other community organisations as well that are looking to better include people in online formats. Yes, it is a challenge and it's new to me. One thing I've been doing is emailing people beforehand and just asking, do you have a communication need or needs? You know, people might, if someone needed an interpreter or closed captions, they can tell you. I always try to offer closed captions, and I send people instructions beforehand, written instructions, and there's great videos on YouTube about how to use Zoom or use Teams. I send people that stuff so they know how to access them. I also offer some people a practice call beforehand, like a 5-minute call beforehand to sort out those issues. Another thing is I keep the group somewhat small, like sometimes 3 to 4 people, so that everyone has a turn to speak and it isn't all people talking over each other. And setting clear ground rules about everyone takes a turn and mute your microphone, you know, all the usual stuff. The other thing is, what I found a challenge was, it's not just that people have hearing loss. Some people I've spoken to have that noise sensitivity I was talking about. So like they found sudden noises painful, you know, even someone laughing in a meeting, you know, getting my head around, okay, it's not just about hearing loss, it's other types of hearing problems. And so telling them, you know, it's absolutely fine to mute the meeting, or if you need to go and take a break and come back, or you need to leave a bit early, keeping the meetings a bit shorter, not really long, just all those things. But normally just asking the person beforehand, they usually know what they need as well. And if they want to bring someone with them to help them communicate, you know, can tell them what's been said.
Thanks, that's really helpful. I'm going to pass over to Aisling with the next question.
Thanks. And just a question here, and I think you may have touched upon it in terms of appropriate language. Just wondering, in terms of identity and experience, how the deaf community and the hard of hearing community might differ, and how you'd approach that, because I know identity is quite a big thing. And again, if you could just touch on sort of appropriate language, is it deaf, is it hard of hearing, and those sort of terms, that would be great and really helpful.
Sure. I mean, obviously, I'm not a member of the deaf community myself, so I'm not speaking for them, if you know what I mean. I'm just speaking from my experience. But, you know, I just spoke to a gentleman yesterday who, he had maybe what an audiologist might call severe hearing loss. He used the term deafened. Everyone uses different terms for themselves, you know, like we tend to avoid terms like impaired, you know, hearing impaired. You'd say person with hearing loss, but then someone else might call themselves their own term, and you just go with that. We also avoid, you know, saying things like tinnitus sufferer, you know, it's person with tinnitus, the usual things. But this gentleman I was speaking to, he said he had parents who were part of the deaf community, and he had grown up with all of that, and he didn't find his deafness to be a problem. And you will often hear that from people who are members of the deaf community or people who are kind of part of that world a bit. They have a language that works very well for them. They have all these great networks and organizations. You know, there's deaf comedy, deaf football clubs, everything, you know, the same as anyone else, deaf nightclubs. They may not feel that they have a disability or a disadvantage. It's more that the world around them doesn't cater to them. We're kind of making things more difficult for them, but they, you know, it got attention with the girl who won Strictly, Rose, that, you know, really they can do anything the same as anyone else, but sometimes we make it hard for them. So I think that's one of the key differences, is that, you know, not to just immediately assume it's a difficulty or a disability for someone, particularly if they're a member of the deaf community, because they often have all of the resources and language and abilities and everything that everyone else has. For people who are hard of hearing, it varies because that's a lot of different types of hearing loss. Majority are people who have gradually lost hearing loss as they've gotten older. But not everyone is like that. Some people suddenly lose their hearing in their 20s. Some people start getting hearing loss as a teenager. It's very variable. So they may use different words and all have different experiences. But sometimes it is a bit more difficult. If you get it later in life, you have to learn a new way of doing things. Whereas if you had it when you were young, you've learned how to cope a bit better sometimes. So those are the main differences. And just using the term the person themselves wants used, I guess. Yeah. But I would normally say people living with hearing loss for people who have kind of acquired hearing loss later in life, and then the deaf community for people who use sign language or identify as being in that community.
Yeah, thank you, Eithne. That's really insightful and really helpful. Thank you.
We've had a question about the Irish community. Is there any different pattern at all within the Irish community in Britain, or do you think to other communities, or is there I guess we're aware that different types of experience or different types of occupation can give rise to different experiences with noise and noise levels. People sometimes have had many years of working with very noisy machinery or this kind of thing. Do you have, as a researcher, do you notice any patterns across different community groups, or is it broad brush?
Yeah, I think with the Irish community, like you said, if you're part of the generation who often worked in construction or noisy factories or professions like that, and especially there's better legislation now about protecting people's hearing, getting people to wear equipment that would protect their hearing. If you worked at a time before that happened, you'd be more likely to have hearing loss. Not guaranteed, but you know that often is one of the causes. And as well, in terms of the deaf community, I'm not sure. The deaf community in Ireland have their own language, and they also sometimes have gender differences in language, because I think women went to different schools from men in the deaf community in Ireland, whereas in Britain it was a bit different, I think. And it's very regional. Things like sign language and customs and traditions change throughout regions in Britain. But I don't know about between the Irish people in the deaf community versus British people in the deaf community too much about that. But yeah, I think there would be some differences, but then some similarities as well, I guess.
Thank you. Now, just a question here, I suppose for all of us, both in our personal and our professional capacities, what can we do to challenge stigma surrounding deafness and hearing loss?
I think stigma is a massive issue because it stops people from tackling their hearing loss. And as well, it can, in workplaces, sometimes people don't want to say they've got a hearing loss, or else they do say it and then their boss or their employers aren't very sympathetic or very knowledgeable, and there are accommodations you can get at work, you know, you're entitled to. There's also loads of equipment you can get. If you don't want hearing aids, there's other options, you know, other devices. You can get flashing doorbells, you can get a pillow that vibrates to wake you up in the morning. And the stuff you can get from the council, like fire alarms, smoke alarms, that are suitable for people who can't hear very well. So, you know, but people don't always know that, or, you know, because of this stigma. I think we have to educate ourselves about what hearing loss is, because it's an invisible disability, so we don't realize people have it. And if someone is asking you to repeat a question, keep repeating it, don't just give up on them, be patient, and include them in the conversation. Basic things can help a lot. And have an understanding that about hearing aids, that they don't fix your hearing loss. A lot of family members think, well, you've got your hearing aid on, you should be able to take part now. And actually, sometimes hearing aids don't work very well. If you're in a noisy restaurant or pub, they can make things even more difficult sometimes. So it's not like wearing glasses where problem solved. You know, you need to work with them. If you're related to someone with hearing loss, or you work with someone who has hearing loss, you have to make adjustments as well. It's not just them. So I think it's just getting more aware of what it's actually like and what you can do.
Thank you.
You've spoken about the importance of seeking advice for sudden hearing loss, and also the different options that you could explore if you do have a hearing condition and you go and speak to your doctor or seek help. We've had this pandemic period ongoing really for a long time, and I know that a lot of people are still anxious sometimes about seeking doctor's appointments or help for things because of an awareness of a potential kind of pressure or backlog on health providers. What would you say to people who might be hesitating about making an appointment to seek some advice or help about a hearing condition?
Yes, I know it's, you know, some people are still concerned about attending clinic and things like that, and I understand that. I work beside an audiology clinic, and they take plenty of precautions, and, you know, they'd be happy to make accommodations if someone, you know, say was a vulnerable group. I think that, and there are some places that do like maybe telephone or online consultations. I'm not sure where in the UK, it very depends on where you're living, but, you know, sometimes that's an option for people. Some of the private places do that. I would say, yes, I think everything has been affected by waiting lists. If you have a sudden hearing loss, definitely get it checked out. You know, a sudden change, oftentimes it's not serious, but it could be something, it's signifying something that needs to be addressed sooner rather than later. So always go get that checked out. If it's like a gradual hearing loss, I would start with, again, maybe the RNID. You could speak to someone in that charity and they'll give you advice on where to go from there if you didn't want to go straight to your GP or the clinic. But I think it's worth getting on a waiting list if you feel, you know, a lot of people feel like, oh God, I've got a wedding coming up or something coming up and I need to get my hearing sorted. Better to get on the list, you know, sooner rather than later.
Thank you. And we've had a question from somebody who's looking after their dad, and they say that their dad is living with dementia, and they're wondering if you have any tips for helping to support him to remember to put on his hearing aids.
Yeah, that is a big issue, and that's another reason why we're trying to get people, I guess, to go early to get hearing aids if they need them and if they want them, because then you'll get into the habit sooner. Because a lot of us, it's the last thing we get on the list, and we, you know, are trying to get into the habit of it. Then it is difficult. I think they often do need support from someone else to remember to put in their hearing aids and take them out again. how to support that. I know because my dad was in the same boat and we used to help him with it. Yeah, that it is difficult, I'll give you that. I think sometimes you have to, there's different advice. Some audiologists recommend that people wear them every day and make it a habit, because some people only put them in when they're going somewhere, like, okay, I have to go to the restaurant, I better wear them. And I'm not just talking about people with dementia, I mean people with hearing loss in any person, because then you don't get into the habit and your brain doesn't acclimatize to the hearing aids as easily, and you don't get the full benefit from them. Although I understand for practical reasons, sometimes people don't wear them every day. I get that. Sometimes people get tired from wearing them. But like to try and wear them regularly rather than just putting them in every so often, so that it just becomes a habit. But I know it's very difficult for people with dementia. I do think they need assistance if their hearing aids are something they've only started wearing as they got older, and assistance taking them out as well. I don't know, because I never solved that problem myself. How to, audiologists might have some tactics. There is, we're looking at in our department a text messaging app to, you know, remind people, send people reminders. You might be able to set up some automatic reminders, but then it's always a thing of remembering what the reminder is for. And, you know, it is hard, I'll grant you that. And I don't have an easy solution, unfortunately.
Thank you so much, Eithne. You've given a really, really helpful and talk with lots of tips as well for people thinking about these issues. And it's also great to understand more about the research that you're doing. And at Irish in Britain, we really encourage people who may have an interest in contributing to these kinds of research projects or getting involved in Eithne's research to make contacts with her and her teams to make a difference to the kind of questions and support and policies that might be put in place in the future. So thank you so much to everybody for joining, and we look forward to seeing you again for another Thoughtful Thursday.
Thanks very much.
Thanks, Eithne. Bye.